Welcome back to the Sports Medicine Orthopod, a show about the world of sports medicine and the people who inhabit it. My name is Anthony Yu. We are joined by two incredible guests today. One is making his triumphant return to the show, YouTube style, Dr. Kamran Hamid, who is not only foot and ankle specialist, but he's also a rapper. He's also an actor. He's also a social media star. Kamran, welcome back to the show. What's up, man?
Thank you. As you know, I influence almost 12 people now, so things have really taken off since the last time I was on the show.
Yeah, man, that is an exponential rise in your popularity and influence.
Yeah.
You are like a modern day triple threat. You rap, you act, and you fix ankles. Like, watch out, Justin Timberlake.
Yeah.
Kamran is coming.
Yep. Only good at one of the three. So.
And I'm really honored to introduce Dr. Ben Nwachukwu. So Ben is a sports surgeon from the Hospital of Special Surgery, the famed HSS in New York. He is a team doctor to multiple New York professional teams, including a little team I like to call the Brooklyn Nets. He is also a consultant for the NBA Players Association and co-founder of a telehealth company called Best in Class MD. Ben, what's going on? Thank you so much for joining. How are you doing?
I'm doing great. I'm excited to be here with the esteemed company. So yeah, let's kick it off.
Ben, I really love the exotic background, Ben. So that's
yeah. I mean, I feel like I'm overdressed here. It's like I'm wearing a tuxedo to the beach.
Yeah. I look like I'm in a tacky hotel, and Anthony's like in a middle school locker room.
That's actually where I film the shows. Ben, you win best dressed, best looking. You win the prize. So Ben, how do you guys know each other? Let's start with that.
Oh gosh.
Ooh, I think I'll let Kamran tell this story, and then I'll tell the real version.
We'll give you the actual version of the story. Is I was doing my master's degree at Harvard, and Ben was a MBA student at Harvard at the time. So I had just arrived in Boston. I went to the gym, and there was nobody over there of similar stature to me. Granted, Ben is 6'8", and I am 6'2", which in India is like being 7'4".
Yao Ming over there.
Yeah. And so, anyways. In Nigeria, Ben is actually average height. This is what people don't understand. But anyways, we both, after shooting some hoops by myself, I went to the gym and he had walked, I went to lift weights and he had walked over there. And so he was lifting weights. And the PC version is, I walked up to him and I said, if you don't play basketball, I'm going to kick your bleep. And then he left. Ben's version of the story is different, but I'll let him tell a PC version.
Yeah. I mean, it's a little different. I'll tell it from my perspective. So from my perspective, it was just a day in the middle of August, and I was just getting my pump on. I was on the bench press. I was on the bench press, and after in between sets, I go to get up, and there's this dude across the gym just like looking at me work out.
Was he like?
Yeah. Well, I was wondering
I was like, "Can I help you, sir?"
Why this gigantic guy was just benching the barbell without any plates on it.
But no, basically we met at the gym, just two dudes working out in the gym. And, as the young kids like to say, game recognized game. We're just like, look, we're two smart guys, having a chest day. Let's be friends. And ever since then, we've become besties.
That's right. Love affair ever since.
We ended up sharing a lot in common, Anthony. So one is we love basketball. So we have a very similar sense of humor. And then both of us were interested in going into orthopedics at the time. And both of us had interest in research. And we're sort of early on in the cusp of the adoption of value-based care research in orthopedics. And so we became friends through research and ortho and our sense of humor and basketball. And we just stayed buddies ever since then.
Yeah, that's right. All jokes aside, one of the things that was very, important early on is obviously we had that friendship, but from the technical standpoint, Kamran had his MD degree. I was in the process of getting my MD degree. And he was getting his MPH from Harvard School of Public Health. I was getting my MBA. And, you know, in an ideal world, I would love to have an MBA and an MPH, but, you know, I think with the two of our advanced degrees combined, we were able to look at healthcare in a different way, and sort of bring the best of those two additional degrees to bear as we thought about issues and healthcare problems.
Yeah, I want to get to that towards the end of the show, your work with Best in Class MD. But I want to, first of all, excited to have both of you guys on. You're hilarious together. It's awesome. But Ben, we've heard about Kamran's upbringing. I want to hear about yours. You know, it's not the usual story. You're from Nigeria originally, and then eventually to the United States, but via London. You moved to London, from what I understand, at a young age. What was that transition like at, I think, age 7, going from home to a new country, new continent?
Yeah, so interesting path to my place here on the Upper West Side of New York. You know, I was born in a small town called Enugu in Nigeria, the fifth of 5 children. And, you know, at the time, you know, Great Britain was recruiting nurses from, you know, the prior British colonies. Nigeria is one of them. And so my mom got the opportunity to be a nurse in the UK. She actually left. So she, you know, left my dad with the agreement, obviously, from my father, and, you know, left me and my brothers. And it was obviously a very hard decision for her, but it was something that she did to provide advancements for my family, and, you know, better financial opportunities. And so she traveled to London, and she worked there, you know, for a year or two while I stayed in Nigeria. Eventually, her and my dad made the decision to send me to London to be with her because, you know, at the time I was 6, and I think it was just hard for me at that point to be away from my mom for so long. And so I moved to the UK with my mom when I was 6, and really grew up there. And I think we reached a point where, you know, when I was 16, my mom felt that, you know, I was mature enough to pursue opportunities by myself, and she was, you know, yearning to go back to my dad. And so I came over here to the US and lived with a host family, played basketball in high school, and ended up going to Columbia on an academic scholarship, played basketball there for 4 years, and then, you know, Harvard, and, you know, subsequently the HSS. And so that's sort of been my immigrant journey to America. You know, got my green card in 2016, which was a monumentous day. Hard for green card, let me tell you. If anyone thinks that the immigration system in America is broken, this is one guy who had a student visa for 15 years.
Oh yeah.
Hey, Anthony, I want to brag about Ben real quickly.
Absolutely.
When he lived in the UK, he was also a member of the Junior Olympic basketball team, and he's very humble about his achievements. But he's you know, the smartest guy I know.
Yeah, thanks for that assist, because I want to talk about your basketball connection. So from what I have read, you didn't really start playing basketball seriously until age 14, thereabouts. Is that right?
Yeah, so growing up in London, I was playing rugby, and I was number 8, and so that was kind of my thing. And then I had this growth spurt, and I was like, oh, maybe I should do this basketball thing.
Yeah.
And you know, at the time, you know, my pediatrician, so I have a 7'1" wingspan, and so my pediatrician at the time was like, oh, you know, you're gonna probably be as tall as your wingspan. I don't know if that's true, but for the longest time I was like, oh, I'm gonna be 7'1". Like, time to work on these post skills. If I had known what I know now, I would have been shooting threes. And like, no,
yeah, exactly.
Shoot the J.
Yeah.
But yeah, my claim to fame is Luol Deng took my spot on the British national team.
I mean, like, prior to 14, had you know, just dribbled the basketball, shot around? Like, what was your experience with basketball prior to that age?
Nothing. When I was 14, I told one of my mom's friends that I wanted to pick up basketball, and she ball. I still remember it. It was red and black Chicago Bulls rubber basketball.
Yeah.
And she bought it for me. I went down to one of the local playgrounds, which was a 10-minute walk in London, and just taught myself. And I was always industrious. I remember I wrote a letter to Nike, Nike UK, and I was like, I am 14. I'm 6'3". Sponsor me. And they actually responded, which was amazing.
Really?
And yeah, they responded, and they were like, we don't engage in the nice way they put it was something like, we don't engage in sponsorships at the amateur level. But really what they meant was like, dude, you're not any good. But there is a Nike sponsored team. And so that team at the time was called the London Leopards. And so I ended up going to the London Leopards tryouts. And again, I wasn't any good. I couldn't make layups. I was just taller than everyone. And so they're like, all right, you're on the team. And and just worked at the game, and eventually got better. Look, I think as far as my basketball career goes, I think I maximized what I could given when I started, and the fact that I had jumper's knee bilaterally from playing on the playgrounds in the mean streets of London. So
Kamran put it the best. You're being humble about this journey. So just to recap for the audience, you pick up a basketball at 14. At 16, you're going to New Jersey to play on a scholarship at a prep school. So just imagine if you're the other like 12 kids on that team. You've been balling your entire life, probably been playing basketball since like 5, 6, 7, 8, and you're excited because you get the scholarship to play at this prep school. And then in you walk and you're like, hey man, I've been playing this game for 2 years. Is it hard? So crazy. And then you end up playing at Columbia for 4 years. I think actually, I'm not sure if this record still stands, but at that time you played like every single game. You set the record for like most games played at the university.
Yeah, no, it was it was awesome. My basketball experience, everyone thinks that they're going to go to the NBA, right? And so I had a few moments where you have sort of your reckoning, right? So when you start getting recruited, you're like, okay, like who's recruiting me? Like where's Duke?
Yeah.
And the best team that recruited me at the time was Stanford. I got a call from their coach at the time. And that was nice, but I just don't think that they were recruiting me at the level that I would have been a starter. So I was like, okay, I'm going to probably go to the Ivy Leagues and, have a good career. And even then I was like, look, I'm really good. I think I'm going to go to the NBA from Columbia. And my freshman year, actually, we were playing in Madison Square Garden. We were playing North Carolina State, and Julius Hodge was on that team. And, our scouting report was all about Julius Hodge. And, their center, he must have dropped like 20 on me. And and he was like not even on the scouting report. He was just a decent ACC basketball player, but not going to the NBA. I was like, oh my God, like this guy is just different. I was like, all right, well, time to hit the books.
Yeah, I mean, speaking of which, I've heard Jeremy Lin talk about what it was like to play basketball at Harvard. It's not the Pac-12, it's not the ACC. It's truly like student athlete, right? You're there to get your education first and foremost, and then the sports kind of come after you fulfilled your obligations in the classroom, right?
Yeah, absolutely. And if you guys have any interest in some bedtime reading, there's a book called Beyond the Limelight, where they actually chronicle the 2004-2005 Ivy League basketball season. That was my freshman year. And it's just the concept that, Ivy League basketball is beyond the limelight, in that it's not, the sexy conferences, but it's a grind, right? And so because of the fact that they don't want you to travel for conference games, Ivy League basketball games are played on Fridays and Saturdays. So we would leave Thursday night. We'd have to compress all our classes in Thursday night. And then we would travel on Thursday, between Monday and Thursday. And then we would travel Thursday evening, prep all day, play on Friday night, then take a bus to, the other team, Dartmouth, Cornell, wherever, to play on Saturday. And then we would come back either, late Saturday night, Sunday morning, and your weekend is just, is done. And then you come back Sunday and you're prepping your your coursework for, the following week, right? And so my personal statement actually for medical school that I talked about a lot at my Harvard admission interview was my experience my junior year, where I had to take a 0 on an organic chemistry test because we had a game against Duke, nationally televised game against Duke down in North Carolina on ESPN2, but it conflicted with my organic chemistry midterm. And I talked to my organic chemistry teacher, and I was like, look, this is the biggest game in school history. Can you let me take it a day early? Let me take it maybe even a couple of hours early, on the road. I'll have my coach administer, I'll have whoever you want. Let me do this. And she said, no. She's like, you have to make a decision to either take this test in this auditorium or go play Duke. And I chose basketball, and I accepted the 0 in that midterm. And that was my lowest grade in college. That was my lowest grade in college. It was a B+.
Unacceptable.
It was, in your personal statement, you try to justify your lowest grade, et cetera. And, they ate it up. They're like, oh my God. But it's true, right? It basically is a microcosm of decisions that you have to make. And for better or for worse, I think that, is that something that should be done? Should you make student athletes have to make that decision? I think no. But it just goes to give more props and shine more light on Ivy League student athletes. Anytime I see a 4-year Ivy League student athlete, I have so much respect for them because I know the grind that they've had to do because, their sport was something that they truly committed to and was a full-time job.
Right. Yeah. There's no slack. I remember hearing a Steph Curry interview, and he said during the tournament, played Thursday, back at Davidson on Friday, everybody's studying because they got a midterm coming up, and then they go back to play on Saturday. And it's just like, school is actually a priority in some of these schools, which is nice. I'm just listening to your accomplishments, and it's making me feel a little insecure about myself. I mean, like, I'm thinking about where I was in my early 20s and all the things you had accomplished. There was this one time in elementary school, I scored like 5 goals in a game. I bet I beat Resident Evil once without losing a life. I don't know. What about you, Com? I mean, like, you're like Good Will Hunting of basketball, and then end up at Harvard, which is very Good Will Hunting like, but it's just like you're sort of a prodigy with everything you touch, and it's super impressive.
Yeah. My claim to fame is that during an intramural basketball game, I went up for a rebound and landed on Ben's foot. And then I was on crutches, on and off crutches for like 6 months afterwards. So pretty much,
Come on, let me brag about Kamran for a second. So
yeah, let's hear it.
Yeah, I mean, he is one of the most gifted people, right? Where most people have, a left side dominant brain or a right side dominant brain where they think about things either science or math or art. Kamran is able to traverse both worlds, right? He was a stand-up comedian before going to med school, which is remarkable. And I still remember the talent show that he gave at Harvard School of Public Health. He brought down the house.
Yeah.
Yeah, he had a stand-up show as part of the talent show, and it was incredible. And even today, right, through the things that he does on social media, he thinks about medicine in ways that are different. And it's just incredible because I think that that's really what you need to be a leader in healthcare. You have to think outside of the box.
Right. Yeah, I mentioned at the jump that you're at HSS, Hospital of Special Surgery, and Com, you can probably back me up on this. HSS is kind of like the mecca for orthopedic surgery. Like, you say that name, just the HSS letters, and a million, orthopedic nerd ears perk up because they know immediately what that is. You did residency there, and then you went to another really well-known center in Chicago, Rush, for your sports medicine fellowship. And is that where you started to get this experience with working with professional teams?
Yeah, so I actually had a little bit of experience at HSS when I was a resident. So I was very fortunate to have two terrific mentors, Dr. Answorth Allen, Dr. Riley Williams. Dr. Allen, team physician for the New York Knicks, and Dr. Williams, team physician for the Brooklyn Nets. So started to get a little bit of understanding of how to manage professional athletes. But then at Rush was really where, got some hands-on experience. I covered DePaul. I was the team physician for them for my fellowship year, as well as Chicago Bulls and the White Sox, which was, terrific experience. But I would say that my sort of baptism was in the NBA bubble. Last summer, I spent 5 weeks in the NBA bubble. And at the start of the bubble with the playing games, we had 4 games, 4 games a day. And I was covering every game. It was noon to midnight. The final game would let out at midnight. You take your bus back to the hotel. You get back at 1 o'clock. Have a little snack, because you didn't have dinner. And then wake up, go make sure that the teams we're practicing are well taken care of. Have a little breakfast, maybe walk around the Disney bubble. That was my morning workout routine, a little two mile lap, and then get back at it. And did that every day in the month of August. Had one day off, and so that was awesome. For me as a basketball junkie, gym rat. I loved every minute of it. And so after that, I really caught the bug for sports team coverage.
What was that like? I mean, obviously it sounds like you were working a lot, but were there periods where you just felt like you were in solitary, like just totally isolated, just going stir crazy, or were you always kind of doing something to keep yourself occupied?
Yeah, I mean, you're always doing something, right? You're watching these games, and obviously when you're watching the games, you're every play, you're attuned because all it takes is one fall. You want to make sure that, nothing is injured, no concussions, etc. So, you're on edge, watching the games closely. And then you're busy before and after the games. And so that part was easy, right? Because you're working. In the quiet moments, in the downtime, I was very fortunate to have other orthopods in the bubble with me that, we formed a good bond. I actually learned how to play golf on one of my days off in the bubble. There's an orthopedic surgeon in the bubble that I affectionately termed the godfather of the bubble, Dr. Colin Yates. He's team physician for Oklahoma City Thunder. And he taught me how to play golf. And there's a couple videos of me whiffing the ball, but those are the moments that I cherish from that experience.
Anthony, I also say, talking to Ben during these times, I think a couple of the really interesting things. One is like, as a team physician for a professional sports team, there is some pressure on you. It's like these are patients at the end of the day, but they're patients that require 10x as much attention, and the stakes professionally seem a lot higher for you. But added being in a bubble where for some of these guys, you have to make a decision, which is, can we manage this with the limited resources in the bubble? Or do we have to ship this person out of the bubble where they break quarantine and can't come back for a certain amount of time, and then package them up to send them out for someone else? And so I remember, that the discussions with him and his chats with some of the other team doctors that's a real interesting facet, which we may not ever really think about again, hopefully. But I just feel like that was a really interesting aspect of that job. And the other, and maybe Ben want to speak on that more, but the other interesting thing I think also just as a basketball junkie is listening to Ben talk about watching, 4 NBA basketball games back to back courtside, and that you get the opportunity to see things that you don't see on TV and to hear things you don't see on TV. And you can see who is a baller and who is a hooper and who is buckets that you can't really see on TV. So anyways, I just thought it was a really great experience for Ben, and I appreciated being ancillary to that.
Yeah, look, I think most team physicians would say that they are a fan of the sport that they play, or that the team that they take care of. And so in the bubble, there were no fans. It was, media, medical staff, and the teams. And it was just incredible to watch these games and be courtside for them. I'm making up this analogy on the fly. It's like going to a Michelin 3-star restaurant and having the chef cook for you, and watching them cook, and then they serve it to you on the plate, and it's just you. There's no one there, and I think that is a tremendous experience because it's just like a very intimate environment.
How much smack talk was flying around that you could hear courtside?
There was a fair amount. I think some players are probably more notorious for a little smack talk. But yeah, it was nice. It was interesting to hear some of the combo that you otherwise wouldn't hear.
Yeah, the best part about Ben, Anthony, since he's 6'8" and he's very youthful appearing, is that anytime we would go to NBA things, All-Star Weekend, whatever, and I hang out with him, like we get preferential treatment because everybody thinks that he's just a basketball player. I'm like, yeah, LeBron is a close friend.
Yeah.
Yeah. Well, the flip side to that is the flip side to that is when people see you walk into a room, they're like, oh, like which NBA player is that? And then they look at your face to try and figure out who it is. And then they see like the gray, like, starting to break in on your facial hair. They see the balding hairline. They see the bags under my eyes from no sleep. And they're like, oh, he's not an NBA player.
Yeah.
Ignore him. Step away.
Treat him like he's 5'10".
Yeah,
exactly. Like he's 5'10".
Like maybe somebody's brother. Not important.
Yeah, he's one of the Antetokounmpo brothers. I know.
Exactly. Kam, I'm glad you brought that up because all of our tens of listeners well know that you are at Rush prior to Loyola, and you covered a lot of these same teams in Chicago, and you were very generous with your time telling us about how covering sports teams can be very rewarding, but there is that extra pressure, maybe extra time commitment, and the calculus and the decision making can be somewhat altered versus the people we would see every day in our clinics. Have you found that to be the case too, Ben, in your experience?
Yeah, I think that you definitely need to manage a professional athlete differently than you would a traditional patient, right? Because there's a lot of stakeholders involved. And, you obviously don't want to treat anyone, you don't want to treat your patient differently, but, there are the agents, there are the teams, there are the trainers, there's a player themselves. And there are considerations associated with their injury that are beyond the, I hate to say mundane, but, truly beyond the mundane, where, you're trying to figure out contract, and this injury's impact on contract, not just on the player, but on their family, right? And so it's a much different level of management, and it does involve more hands-on and a lot more of the doctor's time.
Did you guys ever feel pressure, maybe undue pressure from outside sources? Our classic relationship is between us and the patient and potentially their family. But as you said, there's a lot of other people in this room when it comes to a professional athlete. Do you ever feel pressure that might not necessarily be there with a sort of a quote unquote normal patient interaction in these cases where you're caring for a high level athlete?
My priority is always to do what's in the best interest of the player. But, I would say what's different is that I try to get myself into the mindset of the player to understand, some of the decisions that they may need to make and some of the choices that may be in front of them, how that is going to impact their relationship with the team, with with their agent, et cetera. And I think that is the really important part there, and that's a little bit different. And I think that's why, thus far, I've been able to have some good relationships in this space, just because as a former athlete, I think I can relate.
Yeah, like you try not to be influenced too much by those things. Clearly, the priority for you is this human being and what their body is going to be like over the course of their life. But at the same time, sometimes you have to balance the fact that this person may not really have a great source of income after basketball is over, or after the sport is over. And so, the tough ones are not so much the guys that are making 20 million. It's the guys that are making like, 500,000. And it's like that are on the cusp of dropping down to G League or having to go overseas. Those are the ones where I think it becomes a little tougher. And so,
Ben, how did you establish this relationship between yourself and the NBA Players Association?
That's a great question. So the NBA Players Association has an official relationship with the Hospital for Special Surgery. And so as part of the Hospital for Special Surgery's relationship with MBPA, the hospital looks to help provide medical consultancy to the Players Association. And so I stepped into that role as a medical consultant. Prior to the pandemic, part of my work was providing physicals and orthopedic musculoskeletal screens for retired NBA veterans to make sure that they had their musculoskeletal needs taken care of, and then also helping to oversee and set the research agenda for the MBPA and the MBA.
I see. Did that role kind of change a bit when COVID hit, or were you tasked with trying to come up with how are we going to make this work to finish the season and beyond?
Yeah, I think that, as with every industry, you adapt the role. And so that was part of me stepping into the bubble, was the fact that the NBA and the MBPA, came into this collaborative role where they were like, look, we have to resume basketball. How do we do that? And, I offered, myself to serve in the NBA bubble, right? So it's a volunteer role, volunteerism, because at the time that the bubble was being constructed, there was so much that we did not know about COVID and the risks associated, et cetera. And so I think that it changed a little bit in that way. But ultimately, I still still interact with the people on the player health side on the MBPA, and we're still, working hard at ensuring that the players' best interests are being upheld.
We just had an infectious disease specialist on, Dr. Rishi Desai, who said the NBA did a great job. They came up with that 50-page document that details, in excruciating detail, I'm told, steps for this protocol, steps for the bubble. And I think the NBA has gotten a lot of credit and well-deserved for putting this bubble on, and also a pretty successful NBA season. How did this come about? Was it, kind of like a bunch of people in a war room just coming up with these ideas, tossing ideas back and forth? How did these guidelines emerge?
Well, it really starts up top, right? I think Adam Silver has to get a lot of credit for the bubble, right? And just the NBA's response to COVID-19. If you remember, the NBA was one of the first leagues to shut down, to stop playing, right? And, you need a leader who, sort of tries as best as he can within business organizational constraints to appeal to the greater good and to do what's right. Right. And sort of the general rule, the golden rule is, if you do the right thing, it will work out. And, part of that too is having the willingness to seek outside counsel. And so the NBA, they sought counsel from CDC, some of the top infectious disease specialists, they partnered with Yale, and part of their collaboration with Yale led to breakthroughs in rapid COVID testing protocols and things like that. And so, I think that part of it is a willingness to collaborate, excellent leadership, and then organizational delegation. And so, I can give you an example. While I was in the bubble, we had hour-plus long calls, every morning at 8 a.m. to discuss, health protocols and strategy, and then subsequent follow-up calls and, things like that. So a lot of people putting their heads together to figure out the right path ahead.
It was very successful. The NBA had a pretty successful season as well. You cover other sports teams in New York, WNBA and Major League Soccer, if I'm not mistaken.
Yeah, that's correct.
Some other sports, we know March Madness had a tournament bubble. Have you seen other leagues follow suit, follow the NBA's footsteps, or have they kind of charted their own path? What's your observation been?
Yeah, I think that, the NBA and WNBA have been lockstep, and it's been great to watch. I think that some of the other leagues have really charted their own course. So the NFL, sort of did its own thing. And I think, they're in a harder situation just because, the team structure in the NFL is just so much larger, right? So the bubble concept would be difficult to do in the NFL. And, similarly, MLB has seemingly charted their own course. And I think that timing has played a part of it for MLB, just because now, so many people are vaccinated, and, the tide seems to be shifting for COVID.
Yeah. All these measures were put in with great intentions, but I think, as all three of us have talked about in the past, we're observing some of the fallout that's maybe unexpected. And I think it was evident even in the bubble. Several NBA players have come out to say they struggled with the bubble situation, with the isolation. Did you observe any of that when you were there? And obviously it's, kind of carried through as the year's gone on.
Yeah, I think that the bubble is hard, right? Part of the challenge of performing well during the bubble was overcoming the mental side of it. It took a mental toll, and I would say even for me, it becomes it can be a mental challenge to be away from your family and to be doing that for so long. And I was only there for 5 weeks. The people who made it all the way to the finals, they were there for 3+ months. And so I think that, some of the players were vocal about it, about, just the mental. I think Paul George mentioned it, just the mental challenge of being in the bubble. But I would say that the NBA did a good job. You had your daily check-in where you had to measure your temperature, do your pulse ox, and register your negative COVID test. But then they would always ask you, do you need to talk to a mental health counselor? So there's definitely those resources available should you have wanted it. And then they, more so for the players than the doctors, they had all these things that you could do in your free time, right? Where, they had a players lounge, and, you had access to Disney where you could golf pretty frequently. There was a barbershop, there was bowling nights, and, things to, not make it seem as isolating.
Yeah. Yeah. For those teams that you mentioned that did go all the way through the bubble or close to the end, obviously there's been a lot made during this NBA season about whether that shortened offseason, going from the bubble to starting this NBA season, has had any impact on the injury rates that we've seen play out this season. And particularly, injuries have just ravaged this playoff run. What are you guys' thoughts on that?
Yeah, it's contentious, right? So I think that some people have released data saying that, look, the total sum number of injuries are the same this season compared to other seasons. I think Adam Silver actually very recently, potentially within the last 24 hours, 48 hours, went on record as saying that he thinks that the injuries during the playoffs and during the season were as a result of the short turnaround and the condensed season. So look, I think that it's multifactorial. And it is likely that, the schedule is what played a role. I think that obviously you can't prove that, but I think that it is a tough turnaround.
Yeah, I agree. I don't know what the answer is, but hopefully they're not going to do it again, so we don't really find out. I think one of the things that'll be tough is for the NBA is the rise in load management and how that is undertaken, because it's not a bad idea. I mean, for the rest of us, if our bodies are failing, we take a little time off, and so it makes sense that they should be able to do it. But it's also tough when you pay a lot of money to go watch your favorite basketball player, and then he's just sitting out, and it's a sore knee or something like that. And so I don't know how they balance that. I don't envy Adam Silver.
Yeah, I think, Ben, what you said is we don't have evidence to prove these things kind of either way. LeBron James came out pretty infamously now with the long Twitter posts basically saying that, in his opinion, there is a link between the decreased rest and the number of injuries. And again, that there's not evidence really to prove that. There's not really evidence to disprove it either. But he's one of the greatest living minds in basketball that we've got right now. And so if he weighs in with an opinion like that, it's worth consideration for sure, right?
Yeah, absolutely. Look, I think that, you have to take very seriously what the players feel and say. And, I think that you definitely have to take that into consideration, right? And, they know what they're dealing with, and, how their bodies feel. And especially someone like LeBron, right, who's seen so many seasons. And, the fact that this season feels so differently compared to his prior seasons, I think is definitely something worth being taken seriously, or as we say in the scientific community, level 5 evidence.
Yeah. On the flip side, are you guys concerned about the long layoffs that our athletes who don't get paid to play sports on TV, particularly, our youth athletes have had to endure because of COVID? Like, is there concern that there might be an increased injury rate because they're coming back after such long layoffs and, not really in the shape they used to be, and maybe just, so anxious to get out there, they're going full force? Kam, what do you think?
I mean, even aside from the pandemic, this is a story we see over and over again, which is disuse, and then there's a disconnect between what your brain thinks you're capable of doing, what your body thinks you're capable of doing, and then overuse injuries. And so it's like we have the Chicago Marathon here, and every year in September it starts raining stress fractures all over the place. And so I think you'll see a little bit of that, but I don't know. It's life, man. Just just take it as it comes. Good for business, I guess. Just kidding. Edit that out.
Absolutely not. What do you think, Ben?
Yeah, I mean, I think it's definitely a concern. Especially in the youth sports arena. Some of these high school athletes will not have played sports, at least in the Northeast in New York, in a year and a half, 2 years for some of them, 2 seasons. And so, at least the ones going to play the spring season. And so it's definitely something that we are taking seriously. We are taking efforts to educate, the coaches, the trainers, athletic training staff around load management and gradual return to play. It was something that we just have to keep an eye on. But I definitely think that there is an increased risk for return to play injury.
What do you guys think about the sort of psychological impacts that COVID has sort of ravaged? Like I said, sort of unexpected fallout, but we see people acting crazy at airports and grocery stores, fan behavior at the beginning of the playoffs as arenas were starting to fill back up. But even, Aaron Rodgers has come out to say that he's been dealing with some mental health struggles. And I think it's going to apply much more so to the general population, particularly, say, athletes who've been denied sports for a year and a half. Is there a way to anticipate this or measures that we can put in place to support folks who are struggling? What do you guys think?
I think this is a global issue that we as just humanity are dealing with, is that the interconnectivity of the internet has been really, really wonderful in so many ways. But in another way, we are finding ways to feed our brain with these dopamine hits. And you look at social media and TikTok and all these other things that I use, but it creates this this short form algorithm based entertainment, and people now essentially their brains are demanding that they are entertained by this. But I think the problem for us is that we're social creatures, and the combination of us being glued to our phones. There's this I read a great article one time about how NBA players don't have as much camaraderie, because when they leave the court, they're back on their phones. They're just like us. They're like looking down at it. They're not talking about things with their teammates quite as much as they used to. And so I think a combination of that isolation plus the actual isolation of the pandemic, I think you're going to see a lot of mental health issues. I think all of us are feeling it to some degree.
Yeah, I totally agree with that. And I think that there are things that we won't even realize are issues until, potentially the fall or early 2022, with a return to new normal. I have a friend who is a child psychologist, and, she was mentioning sort of this idea that she's seeing some kids who have a problem with getting rid of the mask, where they have actually come to enjoy having the mask in school, and it's sort of become this crutch, and they don't want to show their face. And that sort of took me by surprise, because I just would never have thought about that. But there are COVID and the ways that we've changed our lives have impacted so many people in so many different ways that things may manifest themselves in ways that you don't expect, right? So the example that you gave of, a fan throwing a bottle at Kyrie, in my hypothesis is that that's a manifestation of COVID angst. And so I think that there are, definitely a global phenomenon. I think it will manifest itself in various ways throughout all arenas, sports or otherwise.
Yeah. Well, it'll be interesting to see how things play out, but I think the impact is not quite fully developed at this point. That is a terrible segue into my next topic, which is I want to talk about best-in-class MD.
Yeah, thanks for that lead in.
Yeah, and speaking of depression, Ken, let's talk about your startup company.
Yes, let's talk about it. What is it? How did you start it? Tell us.
Yeah, so my company is called Best in Class MD. The day that New York was shut down for COVID, or at least the hospital was shut down, I remember like just March 15th, 2020. And I was in my office just tidying up some stuff, unsure when I would go back to work because, they were essentially shutting down the building. And elective surgeries were no longer. And my orthopedic partner and now BICMD co-founder came into my office and was like, look, we're going to have this indefinite period of lockdown, unclear how long we're going to be shut down for. don't rifle through your Netflix catalog. Think about how you can use this time to create a lasting impact on the work that we do, because you're never going to have, hopefully, never going to have this much time to work on something. And so we set about figuring out, trying to understand challenges in orthopedic surgery. And we came about the idea that there's really an access issue. There's an issue of being able to access the top musculoskeletal experts, and then really having visibility into who those people were. And so we basically projected what we said, look, these are the challenges, these are the issues, where is the field going to go? And we said, I think that this telemedicine thing is here to stay. And so we created a company around creating 24/7 access to top musculoskeletal providers in the space, both for synchronous and asynchronous consultations. So synchronous being real-time video chat, tell me about your injury, and then asynchronous being the medical record reviews. And at the time of recording this, we have 130 orthopedic surgeons across every musculoskeletal discipline. We cover every state. And we're excited. We're excited about where the field is, where we're taking it. We are, I hope that we are, disrupting healthcare, because the musculoskeletal space needs a lot of help. There's a fair amount of waste in the system, and I think ultimately the patient is not at the center of the healthcare paradigm, at least in MSK, and so that's where we hope to go.
Yeah, I think every center or major centers are trying to expand into this telehealth space, but probably for sort of their local patients. So for you to tackle it on more of a nationwide scale is a pretty interesting. How have those interactions been from both sides? Do patients seem to enjoy accessing somebody who might be in Florida and they're living in Nevada? And then same thing from the physician side. Is it proving to be kind of a rewarding experience?
Yeah, no, absolutely. So the way I think about our business, and if there are any hospital administrators watching your podcast, I apologize. But I think that the hospital and the way that healthcare has been historically provided is like Blockbuster. And Best in Class MD and some of the other digital health solutions are like Netflix, right? Where if you're a hospital, you can create a local network of providers, but we're creating a national network where we are giving patients access to the national network, right? Why should you be limited to the orthopedic surgeons in Idaho when you can talk to orthopedic surgeons in LA, in New York, et cetera? And that ultimately, I think, will break down barriers to healthcare, right? A lot of communities that are underserved will be able to have access to some of the best providers. And then on the provider side, providers really enjoy it. So one of our, leading doctors and early investor, Dr. Bob Anderson, he's, world-renowned foot and ankle surgeon. And he fixed Kevin Durant's Achilles, and one of the things that he has really liked about our product is that it allows him to step outside of his four walls, right? And so the average Joe can tap into Bob Anderson's clinical expertise, which I think is really great, and the way that we should, as a society, look to position our healthcare.
Anthony, if I can,
please.
I wanted to comment on how great this company is, and I am not an investor, and because of my job, I actually can't participate in it, unfortunately, because this is part of the future of healthcare. And if you look at how our traditional health systems work, which is you try to have integrated practice units with everything under one roof, it's very costly. But these interdependent systems have limits. And what Ben's company's part of what it's doing is creating some modularity to this, that you could get your x-ray at an urgent care and then have immediate access to one of the world's experts for something. And whereas before you only had, you get your x-ray there and you only had access to an undifferentiated doctor or extender. And so this is, I think, going to be a real game changer. It's going to disrupt standard health systems. There will be some role for brick and mortar in surgery, at least now, until that becomes virtual as well.
Let me just put on my Oculus and
we're all
do this ACL for 5,000 miles away
until we don't have jobs. And Ben is the world's first trillionaire. But anyway, so I think that's going to be very disruptive. And digital health truly is the future. And so anyway, I really am excited for Ben. One of the wonderful things about our friendships over the past 12 years is that we talk essentially every day, and we get to bounce ideas off each other about how we're going to make healthcare better. I have a friend that is a family practice doctor in California, and he left and he went to Canada to practice. And he ended up coming back to the United States, and he said that in Canada there is universal coverage, but there's not universal access. And I think this is what is beautiful about Ben's solution at BICMD, is that they're creating universal access. And for anyone that says that that these, telemedicine companies that require a premium payment, which is to see the world's best doctor. Well, first of all, you're seeing Bob Anderson. I mean, like before, that would require an appointment probably months in advance, a plane ticket, a hotel, blah blah blah, and then you'd have a limited amount of time with the guy. Now you can probably have a little bit more time, and even if you're paying a few $100, gosh, this is dirt cheap compared to what you would have to pay before. And so in my mind, the way that Clay Christensen describes it, disruptive technology, this is opening access to everybody. This is actually far cheaper. And though right now you will have traditionalists say that a telemedicine is not as good as seeing a doctor because you can't do the physical exam and all this sort of stuff, or her. But it is going to make quick work of that, and there's going to be a time very soon where telemedicine will be as good as you need it to be, along with all the other data that you're getting from imaging or from physical exams done on the app or whatever. And our traditional doctor's visits are going to be something that we laugh about.
Yeah, it's very interesting because you obviously you don't want to get into the futuristic, Futurama, but I think Kamran raised a few interesting points there. So one is that we're finding that the average time for a consult on our platform is 37 minutes. And so, imagine spending, and we don't actually give our doctors guidelines in terms of how long they should spend with the client. But I'll tell you that, in clinical practice, doctors are not spending 37, or orthopedic surgeons, I should say, are not spending 37 minutes with patients. And part of that is that, in the traditional healthcare paradigm, most of the excellent surgeons are seeing 50 plus patients a day, right? Part of the unfortunate part is that, in the traditional healthcare model, there's a pressure from the hospital systems and even insurance companies for volume, right? And doctors should do volume. But in our model, we say, look, Dr. Smith, set what rate you think, and the client, will pay that rate, or actually the employer, right? So we sell our services to self-insured employers and insurance companies. And I think that the doctor stepping outside the traditional healthcare model, with a little bit of more, I would say value added consultation. They just spend more time, and then they create a report at the end that really leads to a more satisfied encounter. And I'm biased obviously because I started the company, but I think it is just a more satisfying and patient engaging encounter for both the doctor and the patient.
Yeah, two comments. One, there's a little too much bromance going on here. So at the end of the show, I'm going to isolate each of you, and you're going to smack talk each other. The other thing is, so how would it work? Say somebody in Arkansas has an ACL tear, they consult with you up in New York. Do you have a network of, you give your opinion, yay surgery, nay surgery? If they decide for surgery, do you have like a network of surgeons that you can say, hey, this is my trusted colleague local to you? It's not going to be possible for somebody out of state to come see you up in New York every time they need surgery. So how does something like that work?
Yeah, so the person comes on the platform. They can either be referred to a platform because a current existing doctor gives them a link to their individual profile, or they could just go on our entry page and essentially browse through our list of doctors. We had a client who essentially got 3 opinions in one afternoon, and then actually ended up flying out to have surgery with the doctor that they got the opinion from. And so, look, our business is not in the medical, tourism. But I think that an argument can be made for travel to centers of excellence, right? And so when you think about the financial value of having a surgery that minimizes complications, that reduces your risk of subsequent future surgery, and that optimizes your outcome, there's definitely a dollar value to that. And so we find that some users will fly out to the doctor that they have a consult with on the ICMD. But beyond that, we can make local referrals. And part of our choosing algorithm for selecting a doctor, you put in your zip code. And so we can make recommendations based on doctor proximity to you. So that's really one of the nice features about our platform as well.
Would you think about expanding this beyond the world of musculoskeletal care?
You should be on our strategic advisory board. So yeah, look, I think that expert medical opinions are very much needed. So orthopedics is the second leading driver of expert medical opinions. The number one is oncology, and so we are looking to expand to oncology because I think cancer patients, they need answers. Similar facets apply where it makes sense to fly out to a center of excellence. And the reality is that the sense of urgency is even higher because you need the right diagnosis and you need the right treatment because time is of the essence and for some cancer diagnoses.
Gotcha. All right, Kam, I see you yawning over there. Yeah, I see you, man. I see you. What's going on?
It's way past his bedtime.
Yeah.
What's going on
6 p.m. I usually go to bed at 6 p.m.
What's going on with the music? You've been dropping tracks, bangers pretty frequently. You've been putting on some just funny stuff on Instagram and TikTok and whatnot. What are you working on next?
I've been spitting some hot fire recently. Yes.
Yeah, that's right.
I actually recorded a song recently called Mean Doctor MD. So anyways, I'll hopefully release that in a couple of days. But yeah, it's been, things have been going well. I think I've enjoyed the arrival of the internet because unlike stand-up before, which required a ton of preparation and then driving to the comedy club and this and that, and irritating my parents by doing it. This is easy. Like short form stuff is easy, or is like a lot easier and it's fun. And so anyways, it's been a good way to play while still being serious at my job.
When do you come up with your lyrics? Like, I imagine you just, operating, and then, but in your subconscious, you're like coming up with lyrics for your next hit.
Actually, I pretty much just write lyrics while I am working out, or usually if I go for a run by the lake, I'll find a beat that I like that can evoke some sort of emotion, and I have some theme that I want to stick with, and then I just listen to it on loop as I run up and down the lake.
Nice.
And that's my creative process.
All right. Well, guys, it was great to see you both. Thank you so much for coming on. Let's finish up with 5 questions with Ben Nwachukwu. All right. Here we go.
All right.
Number 1, who is stronger, Ben or Kamran?
Physically, Ben. Emotionally, Kamran.
There you go. All right. I'll take that.
All right. Number 2, Ben. So you're a former college basketball player, current sports surgeon. What's more exciting, dunking in a game or completing, finishing off a super hard surgery, like 10 out of 10 on the level of difficulty scale?
Super hard surgery.
Yeah.
Super hard surgery. Yeah. There's nothing better than the feeling when, you have a tough case and you are done and you do the last part of the case and you're like, yeah, crush that. And then, you disrobe. It's honestly the best feeling.
Yeah.
It's such a good feeling.
Takes out,
and by this, to the non-medical people, I don't mean like take off my Hugh Hefner robe. I mean take off my surgical gown. I have scrubs on underneath.
Just closing the incisions. New.
What if you were dunking on Kamran?
That's actually happened.
I've done that plenty of times. That's
okay. All right.
That's why he did that many times before his Achilles rupture. Now that he's landlocked, he's not able to do it anymore.
That was actually one of the next questions, which is, as a former high-level baller who spends a lot of times around the Brooklyn Nets, do you ever just get this itch to go out and ball? Like, you're like, just let me change into some shorts right now and lock up KD. Do you ever get that itch?
I totally get that itch. And, sometimes like at games, I'll say under my breath, put me in, coach. I'll shoot around every once in a while, and just the jumpers just don't fall the same as they used to. Not as many swishes. So my days are completely done.
I want to see you on the sidelines, like stretching and just getting ready, just in case they're ready for you.
I definitely fantasize about it. I'm like, all right, what if could I last a minute on the court, like one or two up downs? Like, I just want to just give me some shorts.
Yeah.
I'll keep my blazer on. I just want to do 1 or 2 up downs on the court and see if I can run. I probably would rupture my other Achilles on the way back up the court. But like, could I get a rebound? Like, what would be my stat line if you put me in a game? What would be my stat line? Like 1 rebound. I could get 1 assist. I think I could get 1 assist. Maybe.
There you go. At the end of that 1 minute, then you just disrobe because you're so satisfied with yourself.
Like, crushed it, guys. Like, why is the team physician walking down the sideline naked?
You throw your dress clothes into the stands, and everybody's just like, what is this?
Throw my loafers. You can have
my loafer with a marking.
You can have it, kid. No, don't throw it back. You can have it. It's yours. It's yours.
Like, thank you.
You want my dress socks?
Yes. All right. So that's 3 questions. So question number 4. So Kamran covered a lot of Chicago sports teams, like we mentioned earlier. You also covered the Joffrey Ballet, which you talked about when you came on the show the first time. I asked you, Kam, a similar question when you came on about who are the toughest athletes in your experience, NBA players, Major League Baseball players, or ballet? And your answer was?
Ballet.
Yeah. So Ben, same question for you in your experience. Who's the toughest, NBA, WNBA, MLB, MLS?
So WNBA. And so it's, for me, it's not even close, right?
Yeah.
So I think that the WNBA players just don't get enough credit for how hard they work. They essentially play 2 seasons, right? A lot of these women, they will finish WNBA season and then they'll go play overseas, right, because they're chasing financial opportunities, because, their contracts are just not the same, right? And so they will often, play through injuries, talk about load management in that situation. And, this is my first season covering the New York Liberty. They're having a great season thus far, but I just have so much respect for those women and the things that they do, how hard they work. And, they're just the toughest out.
Very cool. Yeah, I can totally see that. Tough ladies, tough athletes. Okay, question number 5. What is your favorite Kamran track? And I've listed a few of the most recent ones. So
I know what he's going to say.
Angry Doc, yeah. Life of an Anesthesia Baller, Dear Program Director, MS4 Ghost. I think that's the most recent ones, right?
No, it's a classic. It's a classic.
Oh, it's a classic.
It's a classic.
All right, I missed it. All right, what is it?
Yeah, so it's Spin Class, off of an album called Spin Doctor, I believe.
Ever heard of it? Yeah. One of my earlier works featuring an MC by the name of DJ Uche. And so anyways, I would strongly recommend you listen to it.
Yeah, all right, so it's a great song. It's a great song.
Yeah.
Kamran, I see you got a lot of supporting players in your videos these days, who I can only imagine are like medical students or residents. Are you paying these kids?
Yeah, I know they'll write me up eventually for abusing them, but as of right now, the ACGME has not caught wind, so we're still good to go. I'm just kidding. They're just friends and volunteers. So
you brought them a Chick-fil-A, and it's all good.
Yeah.
All right, guys.
Wait, we got one question for you. Where are you recording this? Like, is this a studio you have created? It looks good. I love it.
It's my laundry room.
Oh, I love it. It looks great.
Wait, this is your laundry room? Do you live in Jeff Bezos' house? That's a hell of a laundry room.
I'm in an undisclosed location. Yeah. No, I live in a nice house. But yes, the folks that built this house, they did a great job, and they put in these lockers for their kids and whatnot. And I thought, what better way to bring together sports and medicine and
laundry.
That's right, exactly. Yeah, and it smells good in here most of the time. Guys, I really had a great time with you both. We're kind of like this awesome minority trio. It's sort of like Harold and Kumar meets Rush Hour, and Kamran, we should write that.
Yeah.
United Colors of Benetton.
Yeah. Harold and Kumar and PK.
Yeah. Thanks everyone for listening. Please check us out. So everybody's got their social media on here. Best in Class MD. Check out more recent bangers coming out from Kamran, MC Kamran, and check out more exciting content from the Sports Medicine Orthopod. Thanks a lot. Have a good night.
Thanks
so much for having us on.
Hey folks, thanks for tuning in. If you like the show, please subscribe, like, and share. And we love to hear from you. If you have a question about today's show, or you, a loved one, or maybe your favorite athlete has sustained a sports medicine injury that you would like to know more about, please reach out to us on Twitter, Instagram, Facebook, or email. And stay tuned for more exciting content from the Sports Medicine Orthopod. Thanks again.